However, when bypass grafts fail, it leaves limited options in terms of future therapy, and we're often relegated to do a complex endovascular intervention that is both costly and has low patency rates. Hello, everyone. I'm Prakash Krishnan from New York. It's my pleasure today to talk about complex femoropopliteal intervention for patients who have failed bypass graft. It was my honor today to present this at the PVI 2025 conference, and I just would like to give you a brief overview. As you know, there's no holy grail for intervention for critical limb ischemia, and femoropopliteal bypass as well as endovascular interventions are options. However, when bypass grafts fail, it leaves limited options in terms of future therapy, and we're often relegated to do a complex endovascular intervention that is both costly and has low patency rates. So today during my talk, I spoke a little bit about a complex revascularization that was quite costly, in which we had to use multiple balloons, multiple scaffolds, and Vibon endografts. And despite that, even though the wound healed, the bypass graft did end up closing after the wound had healed, luckily. However, there are newer options that may be available that are currently not approved by the US FDA and may not be available here in Europe. And one of them is the detour system for endoluminal bypass using a PTFE graft through a femoral vein and then reanastomosing at the distal popliteal artery. So I presented a first case that we had just recently performed in a patient who had failed two bypass grafts and endovascular therapy and had presented with Rutherford 5 critical limb ischemia. So after this case, which was just done recently, the patient is doing better. His rest pain is resolved. However, the wound continues as it's only been done about 1 to 2 days. But the conclusion of our session really focused on the fact that we need a multidisciplinary team to be able to discuss what are the best treatment options for our patients. Bypass may always not be the best option, or endo may not be the best option. But to have a team of vascular surgeons, interventionalists, as well as a vascular medicine person may provide the best therapy for our patients. And I think that's been the true sentiment of PVI 2025, is that we all have to work together in putting together the best possible plan for the best possible outcomes for these very difficult to treat patients. Thank you.